Hello, and welcome to your COVID-19 educational session on immunization. This session is for staff, students, and volunteers of long-term care homes and other congregate settings that care for seniors. Thank you for joining us. My name is Dr. Alex Summers, and I am the Associate Medical Officer of Health at the Middlesex London Health Unit. Again, the purpose of this session today is to provide an oversight of this amazing and critical intervention that we call the vaccine. It'll make a big difference in making sure that you keep your clients, your residents, the people that you care for, safe. MLHU, as well as yourselves, are committed to keeping patients, staff, students, and volunteers in long-term care homes safe. The purpose of this module is to demonstrate that the COVID-19 vaccine is the most effective way to prevent COVID-19 infections and the single most important thing that we can do to end this pandemic and to avoid further waves of COVID activity within our long-term care home facilities. It's our objective as well to provide education about COVID-19 vaccines and their safety so that you feel comfortable and safe when using these vaccines. This is an overview of what we're going to talk about today. We'll talk about coronaviruses and COVID-19. We're going to talk about the impact of COVID-19 on our community. We'll talk about how COVID-19 vaccines work, how they're developed and why they're safe. We'll talk about the benefits of vaccination and the risks of not getting vaccination, as well as talking about the side effects that can happen when you are vaccinated. Lastly, we'll talk about how and where you can get that COVID-19 vaccine so that you can go and get that vaccine as soon as possible. Coronaviruses are a large family of viruses that originate in animals but can cause respiratory infections in humans. There are novel coronaviruses that have come before the COVID-19 virus, such as the sudden acute respiratory syndrome, or SARS, which was around in 2003, or the Middle Eastern Respiratory Syndrome virus, or MERS-CoV, which came on the scene in 2012. However, none of those had the impact of the SARS-CoV-2 virus or the coronavirus COVID-19. The novel coronavirus, as it was initially called, was identified in Wuhan, China in December 2019. The virus is transmitted via respiratory droplets and aerosols from infected persons. It typically transmits in 2 meters or less from one person to another, like many other respiratory diseases like flu and other respiratory illnesses such as that. However, it can transmit at distances farther than 2 meters at times, particularly if it is an indoor environment where the circulation of air can be poor. It doesn't mean that N95s are required. Droplet and contact precautions are appropriate and effective for disrupting the transmission of COVID-19 unless you're involved in an aerosol generating procedure. The incubation period for COVID-19 is 1 to 14 days. The incubation period is the time that it takes from when you're exposed to somebody who's sick with the virus until you yourself become sick or develop symptoms. So for example, if I was sick with COVID-19 and you were exposed to me today, you would develop symptoms somewhere between 1 to 14 days from now if you were infected by me. The symptoms of COVID-19 include fever, cough, headache, fatigue, difficulty with breathing, loss of smell, or loss of taste. And up to 1 out of 3 people may be infected but not develop any symptoms, or at least any symptoms that they notice. And even these people who do not have any symptoms can still transmit the virus. We can test for COVID-19 through a few different ways. The most common way is through a PCR test, which is the nasopharyngeal swab, which is sent to a laboratory to confirm that the genetic material of the virus is present. The PCR test is the test that many of you will have done over the course of your work in long-term care homes. Other COVID-19 tests include antigen tests. These are the rapid tests which many of you will have been familiar with over the last few months in long-term care. Serology tests are also available, where we take a blood sample and see if somebody has antibodies to the COVID-19 virus. The most important tests are the PCR tests. These are the tests that determine if you are sick with COVID-19 or not. And this is really important for understanding whether or not people around you need to quarantine and whether or not you need to isolate. The COVID-19 virus caused significantly higher number of deaths and illness compared to other common respiratory infections like influenza. The good news is that there have been preventive things that are effective in disrupting the transmission of COVID-19, including personal protective equipment, physical distancing, hand hygiene, good ventilation, and of course, and most critically, vaccination. Since December of 2019, the COVID-19 virus has had a tremendous global impact. At this time, there are over 173 million cases that have been diagnosed worldwide. And that number is lower than the real impact of COVID-19 because we know that there are countries in the world, and heck, even here at home, where we have not tested everybody who would have been sick with COVID-19. So that number is lower than what it would actually be. There have also been, tragically, 3.7 million deaths due to COVID-19. We are also having to worry about what are called variants of concerns. These variants are the result of mutations of the COVID-19 virus that seem to make them either more transmissible or more severe. Some of the variants of concern appear to have a significantly higher rate of ICU admission and appear to put people at a higher risk of death, in addition to being more infectious. Whether or not we're talking about variants of concern or your garden variety original COVID-19 virus, there is no doubt that COVID-19 has had a major impact on our daily activities, and that impact has been felt even more so in long-term care homes and retirement homes. Here in Ontario, the impact has been substantial. We have had nearly 550,000 cases of COVID-19. We've had nearly 9,000 deaths associated with this virus. There's also been significant impacts on employment rates, as well as reductions in access to socialization and social supports that will have impacts on us and our communities for many years to come. The impacts have not been evenly felt. Individuals who are marginalized, who are from lower socio-demographic statuses or from other marginalized groups, have borne the brunt of COVID-19 more than others. And it's important that we recognize that when we get vaccinated, we're not just doing it for ourselves, we're also doing it for others, including those who've borne the brunt of COVID-19 to date. The impact in Ontario can be seen tragically even when we look at the number of cremations done per week relative to the baseline. The blue line here shows the weekly average number of cremations that were done in the years leading up to 2020 and the pandemic. And as you can see, the average number of cremations typically was higher during the winter months and lower during the summer months. However, during the COVID-19 pandemic, the number of cremations has been higher across the board. It's been higher in the winter, certainly, but it was notably higher March through May of 2020. Why was that? That was because of the impact of the COVID-19 pandemic, specifically on long-term care homes and amongst older adults. More people have died in Ontario as a result of COVID-19. The impact locally has also been substantial. Back in April of 2020, we had our first wave it now doesn't look so big. However, it impacted long-term care homes substantially and resulted in a number of deaths. Things, however, got much worse as we got into the fall of 2020 and particularly into the peak of wave 2 through December, January, and February of 2021. Our third wave was large. However, as we will see, the impact was less significant amongst older adults and long-term care homes and retirement homes because of the success of the vaccine program. However, it has still had large impacts on community cases, employment opportunities, and educational opportunities as well with the closures of schools. When we look at the deaths here locally, as you can see, the deaths in the first wave, which appeared small on the total case count perspective, were still high. And this is because of the volume of cases in long-term care and amongst older adults. It got worse during the second wave, but it got better during the third wave because of the vaccination program. In total, we've experienced 221 deaths in the Middlesex London region since the beginning of the pandemic. As I mentioned, the pandemic has been substantial in long-term care homes. During wave 1 from February 26th to August 31st of 2020, there were nearly 6,000 residents and nearly 3,500 staff that were infected with COVID-19, resulting in over 1,800 deaths amongst residents and 8 staff deaths. The second wave from September 1st to February 28th, 2021 resulted in over 9,000 resident cases and over 8,000 staff cases, with again nearly 1,900 deaths amongst residents and 3 staff deaths. The third wave, although significant amongst our community, was notably less impactful in long-term care homes. There were only 300 resident infections and over 1,000 staff infections and 27 resident deaths and 2 staff deaths. The reason for this reduction was because of the vaccination effort. So what happened? Well, this graph tells a pretty powerful story. The green line shows the number of cases amongst long-term care home residents. And as you can see, it was substantial in the first wave and actually was substantially higher than the number of cases amongst community dwelling individuals older than 70 years of age. And in the third wave, similarly, the number of long-term care home cases also peaked, even as community dwelling individual cases peaked as well. But look at what happened during the third wave. Although during the third wave, there was another peak of cases amongst community dwelling individuals over the age of 70, there was not a peak amongst long-term care home residents. Why? What was different here? Well, what was different was exactly what you think it is, which is that the vaccination campaign happened near the end of wave 2 and resulted in substantial protection such that we did not see a peak of cases among long-term care home residents during the third wave, despite the fact that the numbers in the general community were higher than they have ever been. When we look at the peak of the third wave, it is important to remember how much worse it would have been if not for the success of the vaccination program in long-term care home facilities. This is a miracle. But it's a miracle that we can replicate and a miracle that we can continue thanks to the availability and willingness of staff, visitors, students, and residents in long-term care homes to take the vaccine. Remarkably, 8 weeks after the start of the vaccination program, the estimated reduction in COVID was nearly 90% in long-term care home residents and nearly 80% in long-term care home healthcare workers. The reduction in COVID-19 deaths in long-term care home residents was nearly 96% after 8 weeks. Again, miracle. The impact of vaccination on long-term care home residents, again, has just been remarkable. And as we see here, during the third wave, the number of COVID cases amongst long-term care home staff and residents has been nearly nil, and certainly essentially zero relative to what we've seen in previous waves where the vaccine was not available to us. In summary, vaccines save lives, and the COVID-19 vaccine in particular. So let's talk about COVID-19 vaccines. How do they work? Well, just like every other type of vaccine, COVID-19 vaccines train your body's immune system to recognize and fight off the viruses that cause COVID-19. Pfizer and Moderna are mRNA vaccines. These vaccines that are developed using mRNA technology do not change your DNA. mRNA exists in our body and is produced and destroyed each and every day. mRNA functions as the temporary design plan that your body uses to build things. And so when we give you an mRNA vaccine, we're giving your body the temporary instructions for how to build some of the components of the virus so that your body can learn how to respond and recognize that virus so that when it shows up in real life, your body already knows that it's something that it doesn't want around. That is called immunity. The mRNA vaccines are a newer technology for us, but they're not that new, and we'll talk a little bit about that in a moment. The mRNA vaccines, like I mentioned, and that's Pfizer and Moderna, provide instructions to your cells to make a coronavirus that will trigger an immune response. It makes a coronavirus protein that your body can learn to recognize. There are also viral vector vaccines. They're not as commonly used in Canada, such as AstraZeneca and Johnson & Johnson, or the Janssen vaccine. These vaccines are called viral vector vaccines, and they use a virus that has been made harmless to produce coronavirus proteins in your body without causing disease. And again, those proteins act as the signs for your body to respond to. And man, do these vaccines work well. In fact, COVID vaccines and COVID-19 vaccines are up to 100% effective in clinical trials at preventing hospitalizations and death. The estimates in the real world are that even 95% of deaths can be prevented by the COVID-19 vaccines. We continue to collect more and more data on the real world effectiveness of these vaccines, but one thing is clear, they do the job. They do the job as well in preventing mild infections as well, with estimates between 70 to 90% of mild illnesses being prevented because of the COVID-19 vaccines. These are remarkable numbers for any vaccine. The flu vaccine, we hope, can be this effective on any given year. And yet here we are with a vaccine that works against something that's much more severe, relatively speaking, than even flu. And as I mentioned, these vaccines cannot give you COVID-19 because they don't contain the live virus. The benefits of vaccination are that they prevent severe illness and death, and they've been proven to be effective at the individual level in that way. They're also helpful at helping to create herd or community immunity that not only protects the individual that took the vaccine, but also those around you, those who are vulnerable, those who may not have as robust an immune response to the vaccine, or those with at-risk health conditions. Residents in long-term care may be at increased risk of severe illness or death from contracting COVID-19. We know that the most predictive risk factor for death or hospitalization from COVID-19 is older age, which of course is who residents of long-term care homes are. High rates of vaccination within long-term care homes reduces the likelihood of outbreaks, as well as allowing residents to live the life that we want them to live and not be as isolated, because we're not declaring outbreaks, and therefore we can ease restrictions. The vaccine got created very, very quickly. And the reason it was created so quickly was because of the massive collective effort around the world to make these vaccines happen. For other vaccine development processes, there's often bottlenecks that include a lack of funding or difficulty recruiting participants for clinical trials. Those problems didn't exist for the development of these COVID-19 vaccines. The COVID-19 vaccines built on over 15 years of vaccine research. There was plenty of funding, and the collective effort of the world's best scientists, governments, universities, pharmaceutical companies were mobilized in an effort to develop these miraculous products. As well, because so many people volunteered, there was large clinical trials that could rapidly get underway in order to prove and show the safety and effectiveness of these vaccines. Safety checks are a critical part of vaccine development. In fact, during the development of COVID-19 vaccines and of any vaccine, there are 3 clinical stages: phase 1, phase 2, and phase 3. Phase 1 and phase 2 are exclusively focused on making sure that the vaccine is safe. It isn't until stage 3 that we actually spend more time worrying about whether or not it's effective. Safety comes first in the development and approval of vaccines. Only vaccines that are proven to be safe, effective, and of high quality can be used in Canada, and they're approved and reviewed by Health Canada through a very rigorous and independent process. The standards of safety, effectiveness and efficacy, and quality have not been compromised to expedite the approval of COVID-19 vaccines. And we continue to monitor for vaccine safety and effectiveness here in Canada and across the world. Here in Canada, over 22 million doses of COVID-19 vaccines have been administered in Canada, with only 1,000 serious side effects reported. That's less than 0.006%. And it's important to note, just because a side effect is reported, it does not mean that the side effect is caused by the vaccine. We receive reports of all events that happen after immunization, and it doesn't necessarily mean that it is linked to the vaccine. For example, each and every day, people, unfortunately, have myocardial infarctions or heart attacks. That means that somebody who got vaccinated tomorrow may have a heart attack the day after. However, they may have had that heart attack whether or not they would have received the vaccine or not, but it's still reported so that we can follow it closely to ensure that the rate of heart attacks is not higher amongst those that received vaccine relative to those that didn't. I use heart attack as an example. Heart attacks have not in any way been linked to the COVID vaccine, but again, it highlights the fact that we receive reports of all of these events, even though they may not be, and likely are not, causally linked or caused by the virus or the vaccine, the vaccine itself. In contrast, the rate of COVID-19 in Canada is significantly higher. There are a number of people that work together to make sure that vaccines are safe, be it healthcare providers, public health units, the Public Health Agency of Canada, Health Canada, manufacturers. Many people come together to make sure that these vaccines are safe. At the federal level, there is a system called the Canadian Adverse Events Following Immunization Surveillance System, which collects data and reports on all the adverse events that may happen, like that heart attack I referenced, and follows those events to make sure that there's not a safety concern that we need to intervene upon. And the system works. And we saw that even with the COVID-19 vaccine. There were cases of blood clots that were seen after vaccination with the AstraZeneca or Covishield vaccine. And as a result, here in Ontario, there was a decision to temporarily pause the delivery of AstraZeneca as a first dose out of an abundance of caution due to the observed increased rate in the rare blood clotting condition. What is important to note is that this was done out of an abundance of caution. And what has now happened is we've actually resumed providing second dose of AstraZeneca to people who received a first dose because we're more comfortable, because of the data that continues to roll in, that the second dose is still well worth it for people who've received a first dose. So the system works. We are monitoring safety. And we're monitoring safety even when rates are not necessarily higher amongst those who received the vaccine versus those who haven't. You may have heard, as another example, of reports of myocarditis and pericarditis following vaccination with COVID-19 mRNA vaccines. Myocarditis and pericarditis are inflammation of the heart muscle or inflammation of the lining around the heart, respectively. This has been noted through some case reports across the rest of the world, and there have been some reports here in Canada. However, what is consistently seen, be it in the United States, in Europe, or in Canada, is that there's no clear association between the myocarditis and pericarditis events and the mRNA vaccines. The rate of these conditions amongst those who are vaccinated is pretty much the same amongst those who have not been vaccinated. In other words, we might just be picking up that heart attack that might have happened anyway. But we monitor this, we're transparent in how we talk about it, and we track these events closely to make sure that if there is a safety concern, we address and intervene. The thing to note is that there are way more risks with not getting the vaccine. Those risks include all the things that we've seen happen because of COVID-19, such as illness, mild to severe symptoms that also can linger for months and months, even if you recover from that acute illness. Hospitalization, such as a trip to the ICU, mechanical ventilation, or failure of your organs like your heart, your lung, or your brain. And of course, tragically, death. There's also the risk of not returning to our normal lives. We may see travel restrictions because of not getting vaccinated. We may see limitations on our ability to hang out with family and friends. Vaccination is a critical antidote to the hardships that we've been dealing with now for nearly a year and a half. Let's talk about those side effects, though. There are side effects that happen when you get vaccinated, but those side effects are predictable, they're anticipated, and in fact, in most instances, they represent your body doing exactly what we want it to do when we give it a vaccine. It represents your body's immune system saying, there's something here that I need to learn how to respond to. Sometimes we describe it as your body doing the training it needs for the real event should it ever occur. For example, if you're a hockey player, you don't just show up to the game without having trained. You train beforehand, which means that you're putting your muscles to work. And after you put your muscles to work during training, you might actually have some pain in those muscles, but it means that when you go to the actual game, you're stronger and ready to go. It's the same thing when it comes to talking about immunization. Your body is putting in the work, it's doing the training necessary so that when the real thing happens, when the real game is on, when the virus actually shows up, it's ready to rock. Those side effects can be common. With Pfizer and Moderna, those mRNA vaccines, it's fairly common to see pain at the injection site. It's fairly common to have some fatigue, headache, maybe some muscle pain or chills within the first 24 to 48 hours after having received the vaccine. It's also fairly common to have some localized redness or swelling around the injection site. Some people get a little bit of joint pain, a little bit more common after the second dose, and fever as well. And again, this is anticipated, it's temporary, it's mild, and it's a sign that your body's doing what we want it to do. The uncommon side effects can include nausea and vomiting and enlarged lymph nodes. And again, these are temporary, they're mild, and they're anticipated. For the Moderna vaccine, the side effects are pretty much the same because they're pretty much identical vaccines. I hope that you choose to get vaccinated. It is the single most important thing that you can do for yourself, your family, your community, and for the people that you take care of in a long-term care home or retirement home. And you can get vaccinated easily now. You can get vaccinated at one of our mass vaccination clinics here in the Middlesex and London region. the Western Fair Agriplex, North London Optimus Community Centre, Earl Nichols Arena, or the Caradoc Community Centre. And you can book online at covidvaccinelm.ca or through phoning 226-289-3560 7 days a week from 8 to 7:30. You can also book and receive the vaccine at select pharmacies. You can call directly to book an appointment, and you can check at the provincial website listed here to determine which pharmacies in our area have the vaccine. Many of our primary care providers are also going to be receiving vaccine to distribute, so talk and check with your doctor or nurse practitioner. You can also check with your employer. Some long-term care homes will be able to provide on-site vaccination. It doesn't matter where you go, just make sure you do. Once you do receive your vaccine, make sure you report it to your facility. If you choose to receive the COVID vaccine, proof of vaccination will be required, actually, at the facility where you work. That proof must be an Ontario Ministry of Health official COVID-19 vaccination receipt, and it will be provided to you wherever you receive your vaccine. At this point in time, we're going to take a moment to test your knowledge based on what I have spoken to today. Before we get into this, again, I want to thank you for taking the time to sit with me today and learn more about these vaccines and more about the miracle that we have experienced within long-term care homes as a result of this remarkable vaccine. It's so important that you get your vaccine, and I hope you seriously consider the benefits of receiving vaccination. We will continue to monitor for the safety and effectiveness of this vaccine. And you can be sure that the health unit is committed to making sure that you have all the information that you need to make a good choice for you, yourself, your community, and those who you work with and work for. But time and time again, the vaccine is proving to be the right choice, and I hope it's one that you strongly consider. Let's talk about testing our knowledge. True or false, mRNA vaccines can change your DNA. We talked about this a few times, and it is indeed false. The mRNA vaccines cannot change your DNA in any way. The mRNA that is provided to you is temporary, it's transient, and it just allows your body to create that spike protein so that your immune system can respond. Next question, can you get COVID-19 from the vaccine? I hope you know this one. We've talked about it a few times. And again, the answer is no. There is no possible way to get COVID-19 from the vaccines. The COVID-19 vaccines are not well studied, and it's too risky to get. This one, of course, is somewhat an opinion and in the eye of the beholder. But what I can tell you is that no vaccine has been more aggressively studied than the COVID-19 vaccine has been within the last 10 years. In fact, I would argue that no medication or intervention, surgery or otherwise, has been as studied, monitored, regulated, observed, cared about as much as the safety and effectiveness of these vaccines. The risk of not getting these vaccines far outweighs the benefit, and I strongly, again, encourage you to get your vaccine. Next question, steps were skipped in the development and approval of the COVID-19 vaccine in order to make it available sooner. And this one is false. All the regulatory process were followed. All the research processes were followed. The speed at which this was done, again, was largely due to the amount of effort, energy, funding, resources, and interest in this vaccine. But no steps were skipped. Next question, long-term care homes are able to ease some restrictions for residents if at least 85% of residents and at least 70% of staff are fully vaccinated. This one I didn't talk about during the presentation, but it's true. One of the real bonuses of getting vaccination within long-term care home staff and residents is that we can get back to normal. We know that the quality of life for our long-term care home residents has not been what we would want it to be. And so we're so grateful that we've got this vaccine, and this will make a big difference in the quality of life for residents. Protect yourself and protect others from COVID-19. Please get vaccinated. Thanks so much for joining me today. Please continue to check out our website at healthunit.com, for more information on the COVID-19 vaccines, their safety, their effectiveness, and where you can get those vaccines. Thank you for all the work and care that you have done to care for our long-term care home residents and retirement home residents over the course of this pandemic. You have not had an easy job, but I hope that the decision to get vaccinated is one of your easier decisions this year and this time around. Thanks again so much for joining me, and I wish you all the best. Bye for now.